February is National Cancer Prevention Month. The American Institute for Cancer Research estimates that 1/3 of cancer cases could be prevented by practicing healthy habits. An estimated 374,000 cases of cancer could be eliminated through lifestyle choices, avoiding tobacco, healthy helpings of fruit and vegetables, being physically active, never skimping on sunscreen, and getting immunizations along with regular medical exams all can count towards reducing your cancer risk. The specialists at Florida Hospital Waterman's Digital Mammography Center guide us through the many factors that can lead to breast cancer and how to stack the deck in your favor.
The etiology of breast cancer is confusing. In scientific terms, they call it multifactorial. There's a lot of things that can lead to development of cancer in the breast or elsewhere in the body. For breast cancer, we know there's a strong genetic history. There are genes that are markers for breast cancer and family histories that lead people to get cancer for other reasons. Other things have been suspected. Certain diets have been implicated with breast cancer. In terms of preventing breast cancer, to a certain extent, you have a hand that you're dealt, and what you can do to help improve your odds is, in general, live a healthy life and have a good diet, but also do self-exams and follow routine screening protocols. That way, if anything should happen, we catch it as soon as possible and give you the best chance to survive. The way we do mammography at Florida Hospital Waterman is most women schedule for screening mammograms. That means it's time for their routine yearly or biannual exam. So they come in, they have their examination by the technologist. That examination is reviewed by a radiologist, and an interpretation is given. And depending on the interpretation, the patient may need additional images. If they need extra pictures, we call them back and we schedule them for what's called a diagnostic mammogram. At that point, they have more pictures taken by the technologist, including compression views or magnification views, depending on what their breast issue is. Then those films are reviewed by the radiologist at the time, and then we talk to the woman and let her know what's going on and what our recommendations are. Also, at that point, if the woman needs a breast ultrasound, we do the breast ultrasound right here in the department and discuss the results of the ultrasound as well. There's a lot of information on a screening mammogram. Sometimes a screening mammogram is not enough to decide what's going on, and we have to call the patients back for what's called a diagnostic mammogram. A diagnostic mammogram is additional views of the breast, some of which may be magnified or compressed in a different way. Depending on what the results of that diagnostic mammogram is, we can decide what course the patient may have. The majority of the women go on to routine screening afterwards. You don't need to have any kind of procedure done. Some women, after the diagnostic mammogram, need to have an additional test, such as an ultrasound, which we can do in the department right then and there. If the woman should need a biopsy after all these tests are done, we call her physician, try and schedule it for her at that time, explain to her what the procedure is and how it will be done, and get everything set up before she leaves so she knows what's going to happen.
Florida Hospital Waterman has been designated a Breast Imaging Center of Excellence by the American College of Radiology. If you'd like more information about their digital mammography services or to schedule an appointment, follow the Curb Cancer Story link on our homepage at yourhometownhealth.com.